Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You enjoyed a nice February weekend. You're looking forward to a good week, starting it out today on Monday. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. Monday, February 8th, 2021. Let's make it a super day and a super week to help us get through this winter. If you're anywhere in North America, other than Iqaluit apparently, where it's warmer than it is in most other places, unusually and strangely, hopefully you're staying warm, and we'll have some fun with it this week, all right? Going to look at 6 areas of health and wellness, as we always do. Somewhere around this video, you can read through all 6 of those areas. If you'd like a copy, we can send that to you. Just DM us on social, send us an email at the clinic, or give us a call. We'll be sure to get that in your hands. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, that doesn't mean that by what you learn, you may not positively impact your health and wellness for today and beyond. And that's always a good thing. So congratulations for being here. It's an interesting one today, so we have several of them to get through. Apparently, according to the Indian Journal of Psychological Medicine, September 2020, a negative personality could be linked to heart attack risk. They did evaluations on 150 myocardial infarction patients, heart attack patients, and revealed that these individuals were more likely to have a negative outlook on life than the general population. So today, Monday, always the beginning of the week, we want to turn around our thoughts and focus on some good stuff, the positive stuff, and create some excitement in your life, even if you have to create it yourself, just to get a good vibe going. And it's good for your heart, that positive outlook of yours. Things are good. The Journal of the American Board of Family Medicine, December 2020, looked at a common joint supplement and found that it can benefit your heart. So far today, some positive thoughts, and the supplement could be good for your heart. They had used data from several United Kingdom National Health and Nutrition Examination surveys, and they found that individuals who took a daily glucosamine supplement to support their joint health had a 65% reduced risk for death due to cardiovascular disease in the following decade. Though further research is necessary to understand the nature of the relationship between glucosamine and improved heart health, they venture that glucosamine may lower systemic inflammation in healthy individuals, or that people who use these supplements may take more care of their health and or behavior and be healthier overall. So they're going to look into why, but some positive side effects basically when we take care of ourselves, and that can create a positive outlook, which creates more positive side effects. So it can feed on itself, an upward positive spiral instead of that sometimes seemingly negative downward spiral health has us trapped in, or life has us trapped in, and our health sometimes. It's cold outside, but the American Heart Association, November 2020, has some ideas for exercising outside, some outdoor winter workout ideas. They recommend doing things to stay fit, like brisk walking or hiking, jogging or running, raking leaves, shoveling snow, depending on the area that you're in. Ice skating is always good, sledding, cross-country skiing, and snowshoeing. All good activities and relatively COVID-19 pandemic safe. So if it's too cold, there are plenty of indoor exercise choices as well, and lots of good virtual workouts available on the internet these days. So not the same, but definitely available and to help get you through, so you can plug into those things as well. Tips for a healthier life from United States Preventive Services Task Force. That's what we like to hear, some preventive healthcare measures, December 2020. They say to prevent disease, to live a healthy life, increase longevity, improve physical, mental, and emotional health, you should get regular health screenings. Early detection can lead to early intervention, which is always a good thing. Don't smoke, meet your physical activity guidelines, eat a healthy diet, maintain a healthy weight, and follow your doctor's advice. Always good suggestions, all those things that we probably know about. We just need a solid reminder on a Monday in February to get out there and do those things, as well as make those choices for ourselves. Sometimes it's as easy as that. And finally, for today, the sacroiliac joint is talked about in the Health SA Gesundheit December 2020 report. Sounds a little bit German, but I could be wrong. They say that among a group of 100 adults with sacroiliac or SI joint dysfunction in your pelvis, close to your hips, researchers observed that a single adjustment of the SI joint resulted in measurable changes in the pelvic angle. The study reveals that specific adjustments can have a positive influence on the pelvis to help correct anatomical alignment. This is great if you have any hip, pelvis, low back, even knee, foot pain, because that alignment, the biomechanics, how things are sitting and moving, directly affect how those parts can feel over time. And by improving the angles and the alignment, it improves the function. And when things work better, they feel better. Now, if you happen to be an athlete, whether recreational or competitive, and or you just want to keep your body moving, these seemingly slight nuances are the things that can build up and create problems over time that can be detected by a proper assessment and corrected sooner rather than later. By the time pain is involved in that dysfunction, it's more challenging, obviously, but it still can be recovered and improved. But we like to try and do that. At first, you might notice something is stiff, doesn't feel as loose as it used to, you're not able to move quite the same way. That's a good time to get it checked and improved, again in a preventive fashion, to keep your positive outlook on all those things you want to do every day, especially pain-free and as loosey-goosey as you can, all right? So that's your daily health update for Monday. Some good motivation for you to start the week, to keep taking care of yourself and those around you. Lend a hand, share a smile, and make it a wonderful week. I'll catch up with you tomorrow, Tuesday, with your next daily health update. It will be a pleasure to see you then. Have a good one.